Welcome to Muscle Research Review for the week of March the 9th, 2015. Quick research summaries for the very busy health and fitness professional. So let's get started. I've discussed before about not relying too much on radiographics as the basis of the origin of a patient's complaint. We found that x-rays of the neck didn't correlate much with any presentation factors such as pain scale or arthritis. However, a new study looked at correlation between low back radiographic findings and back pain, and some of the results are surprising. The study looked at community and occupational-based groups consisting of about 26,107 subjects. Potential pain generators that have been debated include disc space narrowing, osteophytes, spondylosis, end-plane sclerosis, spondylolisthesis, and facet joint arthritis. Here's what they found. A significant association was found between disc space narrowing in both groups. There was also a strong correlation between back pain and spondylolisthesis in the occupational group only. The findings showed that spondylolisthesis may contribute to a specific cause of low back pain, since it's only seen in the occupational group. So if you're trying to explain x-ray findings to your low back patient or client, you may want to discuss disc space narrowing and spondylolisthesis, but not put too much weight on any of the other findings. Have you guys heard of occlusion training? Now, I've been seeing more and more articles coming out about this in recent months. A new study looked at this concept and summarized the mechanisms, gain in strength, and safety issues surrounding training with blood flow restriction. Initially, I was kind of skeptical, but now I'm seeing some potential benefits for certain patient populations. If you hadn't had time to dive into all the research, here's a great summary of all the up-to-date findings. Essentially, blood flow restriction induces hypoxia and metabolic effects, as well as reduction of proteolysis. There was also an increase in growth hormone levels. Occlusion pressure of 150 with an intensity of 20% of 1 rep maximum is usually recommended. However, make note that there are currently no standard training guidelines. Pressure, intensity of pressure, number of sets, and duration actually remain unclear. For gain in strength, 28 out of 30 studies showed an increase in strength usually associated with muscle hypertrophy for both men and women, although data for women is kind of sparse. Surprisingly, a gain in strength is also noted in the non-included muscles. They also found that blood flow restriction without training can lead to a rise in strength and reduce atrophy in knee extensor muscles during immobilization. There's also positive effects on bone health. Safety-wise, rheologic investigations show no evidence of increased risk of thrombosis when studying possible contraindications. Now, this type of training is controversial, but with the favorable results seen, I think more research into adverse effects and safety need to be done. However, this has major implications for rehabilitation of the elderly or the injured, or those unable to engage in a full strengthening program. Future guidelines for training should be published. Definitely something to keep an eye on. If you're prescribing scapular exercises, you may be inclined to use variations of quadraped exercises and multi-joint isotonic exercises. A new study looked at the difference between these exercises on serratus anterior and lower trapezius muscle activity. Here's what they found. The study looked at 16 uninjured healthy male college students. EMG was recorded for the serratus anterior, lower trapezius, infraspinatus, and posterior deltoid across 3 intensities and 5 exercises. The quadraped shoulder flexion exercise actually activated all 4 muscles compared to all other exercises. The modified robbery free motion exercise outperformed the lawnmower free motion exercise and activated the serratus anterior, lower trapezius, and infraspinatus. Neither showed a difference in posterior deltoid activity. Studies suggest that the quadraped shoulder flexion exercise may be the exercise of choice when you want to activate as many stabilizers as possible. However, the study was done on healthy young males, and research based on injured athletes may actually show different results. A new study in the journal Ergonomics wanted to assess the influence of lumbar extension muscle fatigue on lumbar-pelvic coordination during weightlifting. The study was primarily focused on the occupational setting, but I find that it also provides the health and fitness professional some insight into coordinating back training with the rest of the weight training program. The study looked at 15 males who performed weightlifting tasks before and after a fatiguing protocol for the lumbar spine. They found that there was a significant reduction in the average lumbar pelvic continuous relative phase value. They also found that there was elevated spinal loading during the lifting after muscle fatigue. Now, results may help us develop the right exercise prescription. In this case, avoid low back exercises before weightlifting. What are your thoughts on this? Do you take this into consideration? A new systematic review looked at the effects of upper body warm-up on performance and injury. You've probably read a lot about whole body and lower body warm-ups and its impact on performance. There hasn't been much talk about upper body warm-ups. That's where this review comes in. The study found 31 studies that met the inclusion criteria, but none of the effects on injury prevention. The results are as follows. High-load dynamic warm-ups enhance power and strength performance. Now, high-load examples include sprints, fatiguing isokinetic contractions, plyometrics, and repeated contractions greater than 20% maximum effort. Warm-up swings with a standard bat are most effective for enhancing bat speed. Short duration static stretching warm-up has no effect on power outcomes. Passive heating and cooling is a largely ineffective warm-up mode. There's clearly more work that needs to be done on upper extremity warm-up and injury prevention, although these results should give you an idea what exactly to integrate into your training programs. Got a comment? Leave them below. Also, make sure to subscribe to our YouTube channel for the latest muscle research review. Thanks, and see you guys next time.